Hello, hi. Um, Good morning. This is Dr. Siddique, one of the post-surgical training. So today I thought of making a video or a general suggestion about the house job and what to learn, as well as what are the things required so that it may into the NHS system working as a doctor. So uh, I'll welcome Dr. Taimoor. Can you please introduce yourself and let's get the video started.
Okay, thank you so much, Harris. This is around 5 o'clock in the morning, and I am on a night shift. And Harris, I believe, is just having another sleepless night. Anyway,
Yeah.
so the topic that we're going to discuss today is about the house job.
Mm-hmm.
How to do the house job. I know house job is meant to be very fun. I'm not saying that you should only focus on the educational aspect of the house job. So make friends, enjoy your house job. It's one year of your time that you're going to remember for the rest of your life. But because the
Mm-hmm.
focus of these podcasts is to make the transition of a Pakistani or international doctor easier, we're going to discuss some things that we can do in our house job that will make this transition easier. And the things
Okay.
that we should learn, the skill set that we should focus on, so that we don't struggle in our first NHS job. So that would be the main focus of this video.
I will generally highlight what are we going to talk about today. So first of all, we
Yeah.
are going to discuss about the acceptable pattern of house job or rotations in your foundation year, which is acceptable by GMC and Irish Medical Council as well. The second thing we are going to talk about which specialties to adopt and what you need to learn in those rotations, and we'll put some details during the discussion of those rotations as well. So stay in touch. So can you please, Dr. Thamoor, can you please tell me what is the acceptable pattern of internship in for to get the GMC?
Mhm. Okay, so the acceptable pattern that we have to follow under any circumstance is number one, you have to do 12 months of house job. Even a single day less than 12 months will make you disqualified to get a GMC or Irish Medical Council registration. Okay, so 12-month house
Mhm.
job is a must. Now, in those 12 months, there is a second condition by GMC that you should do at least 3 months rotation in medicine and surgery. So 3 month rotation in medicine and surgery is must in those 12
Mhm.
months. Okay, apart from these 3 months, you can do surgical and medical allied specialties. Okay, so the
Okay.
normal house pattern in Pakistan is generally acceptable. Generally
Mhm.
the house in Pakistan and I believe also in India and Bangladesh is similar. It's 12-month house job, and you have to do 4 rotations of 3 months each. Now, our recommendation is that you do 3 months in medicine and 3 months in surgery to become eligible for GMC registration and spend rest of the 6 months in surgical and medical allied specialties.
Let's see. Okay, before going into the specialties, um, I would like to ask some suggestion. That, for example, a person has passed the examination, and from the start of from every country is different. I know about Pakistan. So house job starts, I think, around in April, May. So there is a difference of between final year result and then starting of your house job to get the PMC or license before starting the house job. What you can do in between this time, and how can you negotiate or tell the GMC what were you doing in this time to, I mean, avoid any rejections, and also during your house job, how you can avoid any gaps.
The number one thing, 15 days gap is not a problem. Okay,
Mm-hmm.
there is a set guideline by GMC that there is a selected number of days of your non-clinical gap, which is acceptable. Even if you go beyond those set number of days and you have a valid reason of going beyond those set number of days, then the GMC will be lenient and will give you the registration. I believe, I might be wrong, but I believe the threshold and the set criteria is that you can have up to 28 days of non-clinical
Gap.
vacation, like
Yeah.
non-clinical gap or non-clinical holiday.
Okay.
And but if it's even more than 28 days, and if you have a valid reason or excuse for it, then you won't have any issue. Okay. So
So,
my
uh,
recommendation is to cover those 28 days. Don't get any clinical gap at all. If you are waiting for your house job, you can you can justify it by saying that I was studying for my exam, or I was looking for a
mm,
suitable to work in. And after your house job, if you think there would be a clinical gap, then you can justify it by doing observations, rotations, electives, or whatever in a place, or do some teaching job or something that you can say that, yes, I was, although non-clinical, but I was doing something productive.
or I would also suggest some things here. So you can do observership. Um, that's highly appreciated here in UK. Whenever you apply for job in future, you could sit for your exams like English exam, your PLAB1 exam, and there are a lot. So these are the some of the suggestions. There could be a couple of others. So I had a gap of during my house job. I went for Hajj. That was for around 25 days or 22 days, I believe. But I justified it by explaining them and put the reason, and they didn't said anything. So as I think, as far as you can justify and you are honest about the things, it would not be any problem. But you do not leave these gaps blank in your application. Just justify them.
Makes sense.
Okay. So thank you, Dr. Thumu. Thank you for talking about these GMC acceptable pattern for house job. I'll catch next video for the rotations, which rotations to do, and also what to learn in those rotations to get your to get your first job in UK, and how you can be quite confident in it. Thank you so much. Thanks. Bye.